Oregon has a special election coming up later this month. It's an unusual January election to decide the fate of a health care tax that funds part of the state's Medicaid program. Lawmakers passed the tax last year, but opponents gathered enough signatures to refer the issue to voters. That means Oregonians will have the final say on the tax. Tonight, a debate about the pros and cons of Measure 101. From KGW News, this is Straight Talk with Laurel Porter.
Hello and Happy New Year. I'm Laurel Porter. We're beginning our 10th year here on Straight Talk, and we thank you for watching. We start off 2018 with a special election. Ballots for the January 23rd election went out this week. It's unusual to have an election in January in Oregon. Oregon voters will decide if we should keep or scrap a tax on health care providers to pay for the state's Medicaid program. It's called Measure 101. We're voting because more than 70,000 Oregonians signed a petition to vote on the tax after it was originally approved by the legislature. Joining me, a supporter of Measure 101, Felisa Hagins, a member of the Oregon Health Policy Board, and she works for SEIU Local 49, which represents low-income workers, many of whom are on Medicaid and/or work in health care. Also joining us, opposing Measure 101, Republican Oregon State Representative Julie Parrish, who represents Tualatin and West Linn. She led the campaign to put this law before voters. Welcome both of you to Straight Talk. It's great to have you here. Felisa, your first time here?
It is my first time here. Thank you so much.
Well, before we jump into the arguments, I want to just give an overview to our viewers so they understand what 101 is and what a yes vote means and what a no vote means. You're being asked whether we should keep or throw out a health care tax passed in the Oregon legislature last year. The temporary tax, which supporters call an assessment, would be imposed on some hospitals, insurance companies, and a few other entities to pay for part of Oregon's Medicaid program. In other words, it's a tax to pay for health coverage for many low-income Oregonians. A yes vote would uphold the law passed by the legislature. That would keep the tax in place and maintain the funding source for several 100,000 people on Medicaid in Oregon. A no vote would overturn the tax passed by lawmakers. The state says that would leave them with a budget deficit of at least $840 million for funding Oregon's Medicaid program. That includes lost direct revenue plus matching federal funds. So let's start off with some opening arguments. I'll give you about a minute each to tell us what's at stake with Measure 101. We'll start with Felisa Hagins. Why do you think our viewers should vote yes on 101?
Thank you so much for having me. You know, Measure 101 is absolutely critical. It's a guaranteed plan that the legislature put together, as you pointed out, to fund health care for Oregonians. 1 in 4 Oregonians rely on our Oregon health care plan, our Medicaid plan in our state. And Measure 101 is an assessment on large hospitals and insurers to help pay for that expansion of coverage. It includes coverage of things that we think and hold dearly in our state, like children's health care coverage, or what's being debated at the federal level, sometimes called CHIP. This is the state's portion of that, and it's a really critical ballot measure if we want to protect the health care for Oregon's most vulnerable residents. That's why 160 organizations, including AARP, the Oregon Medical Association, the Oregon Nurses Association, are out campaigning and supporting Measure 101.
And Julie Parrish, why should our viewers vote no on Measure 101?
Well, so actually 90,000 Oregonians signed a petition, and
I just say the 70,000 I got from the voters pamphlet.
Yes, and so that's who that's the qualifying signatures. But actually, 90,000 Oregonians signed a petition. Republicans, Democrats, Independents from every legislative district in the state, because we felt Measure 101 taxes, and understand this is $330 million of a $13.69 billion budget that we're asking voters to consider. Most of House Bill 2391, which was the genesis for Measure 101, is already in law. Those taxes and those revenues are already coming into the state. They're already in law. So $330 million of what we believed and what Oregon voters agreed with us in getting it to the ballot was that those taxes were inequitable, they were unfair, and they were unsustainable. They were taxes on the health insurance plans of individuals, smallest of our small business, taking money out of our K-12 schools because our public schools buy their health insurance in the large group market. In my own legislative district, that is a $1.5 million tax hit to the 3 public schools in my district. It was a tax on nonprofits, and we left Oregon's largest corporations, unions, and insurance companies completely got a free pass. No responsibility at all to help fund Medicaid. And so looking forward into the next biennium, Oregon's share of Medicaid is actually going to increase. We're going to have to come up with more money. And the only way to do it the next time is to increase that insurance tax. If what we hear is true, that this is the only way to fund Medicaid, then the next logical step is that the only way to do it 2 years from now would be to increase the insurance tax. And on people who are paying mortgage-sized payments for their health care, we don't think that's fair.
Anything you want to challenge about what Representative Parrish said?
Yeah, I mean, I think I just want to jump in here and talk about the schools issue that Representative Parrish continues to bring up. I was just on a panel this afternoon with Jessica Adamson, who's a school board member from Sherwood, and, you know, teachers, school administrators, the Oregon School Boards Association, Head Start have all endorsed Measure 101 because they know what's best for our kids and our classrooms. I think that when Representative Parrish throws around numbers about how much this is going to cost schools, we've seen no data on that information. And in fact, those organizations who support children in our state are supporting Measure 101 because they don't want to go backwards. They know the risk that it is to the classroom when we have uninsured kids in our state.
I looked at an editorial that you and some of the other Republicans that are opposed to this wrote. Cedric, I think.
Cedric Hayden, he's a Medicaid dentist.
So he said that $25 million, I think maybe you both co-wrote that, $25 million would come out of schools. Where do you get that number?
That number comes straight from the Department of Consumer and Business Services. We asked them for that estimate as we were voting on House Bill 2391. It's because Oregon school districts buy their insurance in the large group market. The large group market is subject to the tax in Section 8 of House Bill 2391. That's part of the repeal, then that those insurance companies in Section 8 can pass that tax on. So Don Grotting, who supports the tax, has said that basically that school boards, you've heard, the school superintendents, but he actually had to come out in an email to his staff on December 20th and say, actually, yes, this is going to cost us $540,000 per year. And so, you know, when Oregon schools are already some of the most failing in the nation, just taking $25 million from them, the appropriate way to fund Medicaid. And we didn't believe that. We raised that red flag to our colleagues, and frankly, a few of them just, I don't know if they didn't care or they weren't paying attention, but we got the bill that we got. And again, it's $330 million out of a $13.69 billion budget that we're asking Oregon voters to consider. Was this the fairest way to fund Medicaid?
Response to that?
I would first of all like to state that it was a bipartisan group of a majority of both.
But only about 3 Republicans, right, total?
Both the House and the Senate. And we have Senate Republicans such as Senator DeBoer, Senator Ferrioli, Senator Winters, all incredible longtime statesmen Republicans. Senator DeBoer is new to the legislature, who are out supporting Measure 101 and who are out talking to voters about Measure 101. When Representative Parrish talks about her district, her own Westland Tidings came out and editorialized today saying that Measure 101 ensures that the state's most vulnerable residents get quality health care.
Well, let me jump in here because I think this is a good time to kind of give a refresher on what Medicaid is.
Yeah.
Medicaid is a government health care program for low-income people and other people who qualify. People who earn up to 138% of the federal poverty level can qualify. That's a salary of just under $33,000 for a family of 4. In Oregon, Medicaid is known as the Oregon Health Plan and covers about 1 million people, including 400,000 children. Now, a note here, this is different than Medicare, the federal health care plan for seniors. This measure does not affect Medicare. So let's jump into some more of these arguments by looking at a couple of editorials from major metro newspapers. The first one is from the Portland Tribune that supported Measure 101. And I'll tell you just part of what they said, and then we'll argue that. It says Oregon voters are being asked to vote on a health care tax that not even many health experts fully understand. And the editorial board asked, isn't that why we send lawmakers to Salem in the first place, to get these things done? Here's what they said. Voters caught in the middle of a confusing debate over complex policies actually have a relatively simple choice. Do they want to blow up the upcoming legislative session and gamble that in 6 weeks lawmakers can find a better solution than the one they labored on for 6 months last year? Or do they want to test drive the law that was passed last summer before changing it? To us, the choice is clear. Voters should support Measure 101 and hold lawmakers accountable. The law, if it stands, will require reauthorization in 2 years. If it's as bad as critics say, lawmakers will be able to rewrite it when they come back a year from now for the long 2019 session. If it's working, they can extend it. So Representative Parrish, the legislature did work on this for months. As we heard, some Republicans also supported this. Stakeholders were at the table. Why not let the democratic process work and see how this goes?
Well, except this is part of the democratic process. In Oregon's Constitution, citizens have a right of referendum. And where I would dispute the sort of notion that this is bipartisan, Senator Ferrioli, who actually has a voter's pamphlet statement in, and who's no longer a senator, he just got a government appointment to a new job, he voted yes for the tax, but voters should look a little closer. He voted no on the actual budget. So if voting for Medicaid was so important, wouldn't you vote for the whole package? It just doesn't pass the smell test. And so, the one thing that I think that the Portland Tribune article, which you didn't mention, also mentioned was the fact that, even if voters vote no, it's unlikely that Oregonians are actually going to lose. 350,000 Oregonians are actually going to lose health care. And they did point that out in their editorial.
What about that? Because that's the number that we keep hearing. And the main argument for your side, for a yes vote, is the 350,000 Oregonians. I think your side says something less than that, but that they would be at risk.
Absolutely.
Would they really lose their health care coverage if this fails?
In 2003, you had a different group of people sitting before you debating a similar measure, actually. And it was a February vote where there was a discussion about Measure 30 saying, oh, we don't believe that if this measure fails, that we will cut people off the Oregon Health Plan. And what we did in 2003 is we shut the doors to the Oregon Health Plan. 100,000 people couldn't get health care coverage, and we held a lottery in our state. And your KGW has done a lot of reporting on Oregon's lottery for health care. It's been national news. And frankly, if Measure 101 fails, we could go back to that. We could try to piecemeal together some funding here and funding there. It doesn't add up. Frankly, that's why no one is supporting Representative Parrish. No organization is supporting Representative Parrish. This is why we have 165 groups like the Oregon Nurses Association, the Oregon Medical Association, the hospitals, people who are paying the assessments.
But these people wouldn't lose their coverage right away. At least there's enough funding through 2019, I think, right?
Actually, yeah. So we would go into the legislative session in February and we would begin to systematically make those cuts. So does they lose their coverage on January 24th? No, but they lose health care coverage.
Want to respond to that?
I do want to respond. Voters gave us annual sessions in 2010 for things just like this, to come back and do some budget rebalancing based on better data and better information. And what we believe is that the caseloads have fallen. You've seen the stories about the Medicaid audits. You've seen how many people have kind of come off of our Medicaid rolls, people who were ineligible, people who were miscoded. It was hundreds of millions of dollars of overpayments. I mean, the legislature, since the implementation of the Affordable Care Act, has wasted $1 billion of our healthcare dollars on failed software, Medicaid overpayments, lawsuits, and golden parachutes to people in the healthcare system, even whistleblowers. We've had to pay out whistleblowers. The fact is we are going down a wrong path. And you're seeing that play out right here in Oregon, right in the metro area with family care, this dispute where the state came in and tried to forcibly shut down family care. That is a symptom of what is happening right now in our Medicaid system that's not working. And so to ask Oregonians who are paying full freight for their own health insurance to pick up the tab for our failures, it's just not wrong. It's not right. It's inequitable.
What about that audit by the Secretary of State's office of the Oregon Health Authority that showed more than 47,000 Oregonians got Medicaid that were not eligible, and millions of dollars? The number I saw most recently was $88 million that the state could have saved. Wouldn't that fill part of that budget hole if Measure 101 failed? So
first of all, I just want to start out by saying that we're talking about $1 billion. Frankly, with the federal match that the $323 million brings in. There's no dispute here about that. Those are the numbers from OHA. Those are the numbers from DCBS.
If they're federally approved.
And they have been federally approved. We've gotten our waivers before. We continue to get our waivers on these issues. Oregon's been incredibly successful. We've used these same assessments since 2003. Representative Parrish, I'm sorry, you were just fundamentally wrong on the issue. I know that you want to believe it, it's just not true. Well, so let's talk about the Secretary of State's audit.
Let me respond.
Well, we're gonna have a little bit of a dispute here, Laurel, on this, because when we walked into the legislative session, you reported the drumbeat, right? We have a budget shortfall. We have no money. And yet, at the end of the legislative session, Felisa's union got $100 million of raises. Where did that money come from? SEIU got $100 million of raises. Where did that money come from? Where did the money come to fund Cover All Kids, which, whether you like the policy or not, $55 million of additional dollars went into health care that is not Medicaid matchable funding to cover children who are not here legally. When we have federally qualified health centers that do cover their care, $10 million for a bill for universal abortion coverage that went out of general fund as well. $165 million right after this bill passed. We believe these funds are sweepable, and that's how we believe ultimately.
What do you mean when you say, because I've seen that word used, sweepable? What do you mean?
It means the legislature can take any funds in any fund. You can give it a cute name, right? The healthcare fund or whatever. You can call it whatever you want to call it. If it's not constitutionally protected, the legislature can use those funds on anything they want. And they've done it before. When the state sold the Fairview Hospital and they put money into trust, it was called the Fairview Trust Fund. It was supposed to be for people with disabilities. The legislature stole that money from those people and they never saw a dime. And so the 911 fund, your organization, KGW, has reported on when the legislature took money out of the Cultural Trust Fund, where people pay in for license plates to support the arts, and the legislature stole that money too.
Felisa respond.
Well, what I would say is this isn't a constitutional ballot measure that Representative Parrish has put on the ballot to protect health care. And in fact, a lot of the organizations who are supporting Measure 101 have supported constitutional amendments to make health care a right in our state. I think oftentimes when we're talking to each other, we're getting into the weeds on the numbers, which I think is an important fact, right? So that we get our facts right. But I also think that what we're leaving out here is the 350,000 people that you're talking about. The people who actually are on Medicaid every day. I was walking into the studio today and we saw the Lauks up on television telling their story. They're a family from Damascus who Matt got cancer. They rely on Medicaid. Without Medicaid, they would be bankrupt. Representative Parrish will tell you that she supports Medicaid. It's just fundamentally not true. We've heard these arguments over and over again. We'll repeal, we'll replace. Don't worry, everything will be fine. We have a guaranteed solution now.
Let me jump in here because I mentioned that we had two editorials. We did the yes from the Portland Tribune. The Oregonian editorial board came out against Measure 101, and we're going to talk about what they have to say and then get both of you to react to that right after the break. We'll continue our debate on Measure 101. You'll be voting on it in a special election soon on January 23rd. We're back in 2 minutes.